For here in London. It's morning for me. It's later in the day for you. I apologise that my clock has decided to tell us it is 10 o'clock in the UK, 10 a.m. in the UK. Welcome everyone, and thank you for those of you joining us live, and to those of you listening afterwards. I'd also like to welcome all our guests today, who will introduce themselves or be introduced by my co-moderator. Just for your information, my name is Ash Soni and I'm a Vice President of FIP. I'll do a better biography a little bit later. Part of this is about FIP's vision, which is a world where everyone benefits from access to safe, effective, quality and affordable medicines and health technologies. Our mission is to support global health by enabling the advancement of pharmaceutical practice, sciences and education, the creation of one FIP. We're pleased to be delivering this event titled Regional Needs and Drivers for Transforming Vaccination in Southeast Asia. Next slide, please. I will ask Suma to introduce herself in a second. Just for your information, I'm a community pharmacist here in the UK, and I am a Vice President of FIP, and that is and I'm the link between the Bureau and the Southeast Asia Forum, so as part of SEER Forum. I'm also the immediate past president of the Royal Pharmaceutical Society in the UK, and I'm very honoured to be in this position and to have the opportunity to meet and speak and hear from all of you today. Suma, can I ask you to introduce yourself?
Hello everyone, I'm Dr. Sumalata from India. I'm an Executive Committee member of SEER Forum and Central Executive Council member of Indian Pharmaceutical Association. Presently, I'm working as a Vice Principal in a pharmacy school in India. Thank you very much, Ash. Over to you.
Thank you. Next slide, please. And although I was told not to say very much, Lena is very important. She's our facilitator. She makes sure that we're all doing what we're meant to do. So is a critical part of our team and this whole vaccination program. She's the lead for workforce transformation and development, and is the program lead for this whole program of transforming vaccination globally and regionally, and is part of FIP. A really important part of the program and a really important part of what we do. Next slide, please. Just some quick housekeeping rules for you. This webinar is being recorded and is also going out live via Facebook. The recording will be freely available from our website, www.fip.org. And you can always ask questions by using the question box provided. If you look at the bottom of your screen, you'll have a Q&A box and a chat box. Please use both to help to introduce yourselves, but also to use to ask us questions. Again, one of the things that Lena will be doing is looking and managing some of that to help myself and Suma to be able to answer your questions later on through our speakers. And you're welcome to provide feedback to webinars at fip.org. And please remember, if you're not, become a member of FIP at www.fip.org/membership registration. This is a really important part of one of the things you can do beyond your member organizations. Next slide, please. So welcome to this the Transforming Vaccination Regionally and Globally program. Transforming Vaccination is the first FIP transformation outcome-based online program of its kind. And it's underpinned by the FIP development goals. And if you haven't had a chance to see those or to look at those, please do, because they are an integral part of what FIP is doing. The final outcome of this program is a historic global FIP commitment to action on vaccination in pharmacy. FIP Transforming Vaccination Collection 2021. And can I just say, I'm in the very privileged position here in the UK that I already do vaccinations. And actually this year in flu, we have vaccinated over 20% of the population through pharmacy. So pharmacy is a really important part of this program going forward. So anything we can do to help is really, really critical to how we develop and what we do going forward. Next slide, please. So this series has run from September and finishes at the end of this month in December, and is divided into 3 series. Series 1 is the first of 3 series involving 8 events that looked at the identification of needs, to transform vaccination globally and regionally for science, practice, workforce, and education. This involved identifying the needs of the pharmacist and pharmaceutical scientist workforce. The series looked at a pharmacist and pharmaceutical scientist workforce to deliver on vaccination transformation globally and regionally. The series looked at strategy and policy for global change, addressing barriers, and transforming the workforce with various representatives from member organizations globally, sharing their insights and experiences to help challenge and progress pharmacist vaccination globally and regionally. The clear and pressing needs of science, practice and workforce and education were identified, which led into Series 2, where the needs identified in Series 1 to transform vaccination in science, practice and workforce were used as stepping stones to identify actions to transform the programme through identifying mechanisms linked to the FIP development goals. The second of the 3 series, composed of 8 episodes again, that focus on the FIP development goals from the perspective of vaccination, to identify actions to transform vaccination. This series delivers on the needs identified in Series 1 to set the transformative goals by deconstructing vaccination in pharmacy through the FIP development goals across the entire profession. This series aimed to identify mechanisms and drivers to progress the most relevant FIP development goals in the context of transforming, because there are a number of goals. So the series looked at the FIP goals, such as FIP Development Goal 10, which is about equity and equality and access to vaccination by all to improve health globally. FIP Development Goal 13, which is around policy development, and FIP Development Goal 19, about patient safety. 17 of the development goals are linked to vaccination. Through this, concrete mechanisms are identified to transform the vaccination program globally and regionally, and the tools and structures to enable nations and regions to achieve global transformation were shared in these events, which led into Series 3. We are now in Series 3, which will focus on FIP member organizations across 6 regions and how they have addressed or will address these actions to deliver on the commitment to transform vaccines, as we've described, globally and regionally. And the first event was yesterday. This is the second event today. Next slide, please. In this third and final series of 8 episodes, they focus on transformation vaccination on a regional level, where we'll identify regional priorities, challenges, and learning with our members and stakeholders. This series will also culminate in a global FIP commitment to transform vaccination, which builds on the practice, science, and workforce and education needs identified in Series 1, the FIP development goal mechanisms emerging from Series 2, and regional needs and priorities collated in Series 3. Would you like to play the video, Farah? Oh, there's no sound at the moment. As you can see, this is traveling around the world and showing you how we are going globally to be able to share and learn and develop what we want to do. And this is all part of what we're trying to achieve, as I say, on a global basis. So we have traveled around the world, and it will culminate in the FIP Global Virtual Summit on the 17th of December. And please, if you haven't already done so, please remember to sign up to this. Before I hand over, this is my last slide. I just want to ask you to think about these questions and to use the opportunity in the chat box to share your opinion on these 3 questions. So what single factor should be prioritized to transform pharmacy vaccination services globally and regionally? Number 2, what would be the most important achievement in terms of pharmacy vaccination services in your country in the next 5 years? And what else should the FIP commitment to action outline? So if you have an opportunity, while you're listening to the speakers, while you're thinking about this, at the same time, think about these questions as you're hearing what people have to say, and think about how that will apply and can be used in your individual countries. Now I'm going to hand over to Suma, who's going to take us to the program within the CF Forum. Thank you, Suma.
Thank you, Ash. Hello, everyone, once again. Today, our learning objective of this program is to understand the Southeast Asian perspective in delivering on the transformation of vaccination globally as well as regionally. Next slide, Farah. Welcome you all once again. So I am Dr. Sumalata, my co-moderator is Ashok, and we have a special guest, Manisha Sridhar, who is a regional advisor from WHO, Regional Office, Southeast Asian region. And we have 4 more speakers. So Mr. Kampanath, Dr. Rao, and Lali, and also Yagya. So let us start this program. Next slide, Farah. Yeah, so let us, because of her hectic schedule, busy professional schedule, so we are just making Dr. Manisha Sridhar's main presentation first. So Dr. Manisha Sridhar, who is a 3rd regional advisor at WHO Delhi, India since 2009 till date. She is the regional advisor, intellectual property rights, trade and public health, CRO Delhi. And she is a profound speaker with a vast knowledge in pharmaceutical regulatory affairs. And she has also presented many seminars like Symposium on Intellectual Property Rights and Regulatory Perspectives for Pharma and Biotech sectors in national as well as international level. With this brief biography, I request Dr. Manisha Sridhar to proceed with her presentation.
Good morning, good afternoon to everyone. And I thank FIP for this opportunity to make this presentation, Dr. Rao, Sumanlata, Ashok, and the entire team. When I saw the great series of events that FIP has taken up, I thought it would be useful for me to give you an idea on what is happening in the Southeast Asia region, so that FIP can align itself in some of the activities and then we can get more results. This will benefit not only the pharmacy professionals and all our colleagues who are doing a lot of work around the world, it would be beneficial for the health system as a whole. As you know, we are all struggling with COVID-19 targets and how to contain COVID-19 effects. And in pharmacy professionals, we already have an enlightened team of committed professionals who know what this all is about. So why not make, the health system should make full use of this expertise. And this is why I thought that when we look at regional needs and drivers for transforming vaccination, I thought I will just introduce you to a few. There are just 2 or 3 slides. In the first slide, I just want to share with you that we have here the logo of the Southeast Asia Regulatory Network. This is a network, and incidentally, this logo has been designed with great keen interest by all the regulatory agencies of the 11 countries of the Southeast Asia region in WHO, where the Q stands for quality, and you can see the syringes and the tablets in it, which is really to say that we stand for quality as in terms of regulation. Having said that, I thought it would be useful for FIP to know that there has been a lot of deliberation in the Southeast Asia region, Immunization Technical Advisory Group. This is a group that met particularly in the context of COVID-19 in July 2020. And these recommendations I thought would be useful for FIP to keep in mind as you move forward. So the first recommendation is that the WHO CRO support countries for initiating development of preparedness rollout of future COVID-19 vaccines, including the strengthening of the regulatory pathways. This is where the SEER network will contribute in terms of market authorizations. And then the countries should closely follow WHO guidance on processes of COVID-19 vaccine deployment and initiate actions to develop a preparedness plan. Both in deployment and preparedness plan, the pharmacy professionals with their immediate knowledge on the ground can actually contribute to vaccine and COVID-19 response. Countries to strengthen management of AEFI, which is the adverse events following immunization, and establish surveillance in these events. Now, this is also something in which pharmacy professionals can think whether they are well equipped to contribute in some way to this. In view of the need to vaccinate a population of diverse age groups, as you know that in COVID-19, we have been dealing with UNICEF and other agencies before this, and UNICEF is dealing with child vaccination. And COVID-19 is quite a big task for everyone, because here we are going to vaccinate a whole population. It's going to include the children, but it's going to be more than children, even people with comorbidities. So how should this actually be handled is something which is critical. And in view of this, what role can the pharmacy professionals keep in mind? I did want to tell you, this is the latest. We just had this meeting last week, 25th and 26th of November, where a special meeting was once again organized for COVID-19 response. And in addition to what I've just presented to you, these are the three other aspects which have been included, which you might like to build in as you plan your contribution to the vaccine deployment plans. So here they have said that the planning for vaccine, COVID-19 vaccine deployment is presently in progress. And as you are well aware, there are different kinds of technologies using different platforms. And based on the kind of vaccine, whether it is Pfizer, Moderna, or the AstraZeneca, whichever vaccine comes into play, it will need a different kind of a deployment, perhaps even a different kind of a dosage. So how is it that the pharmacy professionals could contribute to this? Because they could also be part of the rollout of this COVID-19 vaccine. There is a vaccine readiness assessment tool which has been developed by WHO. And this was, the assessment tool was distributed to all the countries in the region. And I thought FIP would want to know that between 5th October and 17th November, we have actually collected the data for the readiness assessment on this tool, WHO tool, from all the 11 countries in the region. And this I have already mentioned, that the scale of operations that we are expecting in COVID-19, they cannot be complete without involvement of all health professionals. So when our pharmacy colleagues come on board, they need to bring this to the knowledge of the ministries of health and other agencies, how their role may be critical in terms of ensuring that this COVID-19 vaccination takes place. And this is my final slide. In terms of rollout of the vaccines, what is it that we would request the pharmacy professionals to keep in mind? As I said, the rollout of the vaccine has a big, it's related not only to the logistics, which is the second part, the vaccine, the cold chain and logistics. It will also depend on the kind of market authorization that we get from the drug regulators. Just while I was opening this presentation, I learned that the MHRA, which is the regulatory agency in UK, and Ashok should probably have more information on it, he's sitting there, that MHRA has given the first approval for the Pfizer vaccine. So I hope that is the correct news that I hear. But the others will also be in line. And so this approval of the MHRA is critical, but as it goes out, how the pharmacy professionals could respond in collaboration with other health agencies. UNICEF and Gavi, as you know, are taking the lead in terms of deployment among many of the countries. And it would be useful for FIP also to be involved. And then we need to, given the different kinds of vaccines and the logistics involved, and particularly the cold chain requirements, which may be very critical, it's important to do a very meticulous planning in terms of shipment, storage, stock management, and the vaccine delivery strategy, and also the waste management. Very often this part gets lost. And I thought that I was, as you know, I participated in your previous seminar as well. And I was impressed by the kind of knowledge you all have of the ground realities. So I just put up these few points for you to consider. And your strategies could be different in different countries, but in the 11 countries of CERO, this is something which would be very useful. And for Southeast Asia, FIP might like to consider this as you move forward in terms of COVID-19 response. So thank you for giving me this opportunity to make this presentation. Over to you.
Yeah, thank you, ma'am. Thank you, Manisha, ma'am. Really, you have, in spite of your busy professional schedule, you have given an excellent presentation, and you have informed us so many new things, like that logo is really beautiful and fantastic, in which Q stands for quality is very impressive. And pharmacy professionals can think surveillance for AESI. So thank you for informing about this one also, and about rightly pointing about let us know about three important things which was added newly in this tier form. Planning for COVID-19 vaccine deployments, and about the VIRAT pertaining to the needs of transforming COVAX, the vaccine readiness assessment tool, which is intended by Ministry of Health with support from WHO and UNICEF country offices, provides a roadmap for countries in Southeast Asian region to plan for COVID-19 vaccine distribution. And thank you for enlightening us in this session. Thank you very much for your attention, ma'am.
Thank you, Sumanlata. With your permission, I would like to leave as I have another webinar, but I will email this presentation to FIP so that if it is useful, you can pick up on some of the points that I have mentioned.
Yeah.
Over to you.
Thank you, ma'am. Thank you. Our
thanks
pleasure.
to the entire team once again. Thank you.
Yeah, over to next presentation. It's my pleasure to introduce next speaker, Dr. Rao Adlamudi, who is an immediate past president, Indian Pharmaceutical Association, and a president of Commonwealth Pharmacist Association, and who is a professional secretary of CRPharm Forum. Next slide, please. Now I request Dr. Rao to give his presentation.
Thank you, Sumalata.
Thank you.
Thank you, FIP, for considering me a part of this program. What I would be talking today is the current status of vaccination in India. I was reading about it and I found an article which is almost 30 pages long talking about how vaccination came up in India. But one thing, as a growing up child, I realized that we were vaccinated for smallpox in the beginning, but now the smallpox vaccinations are no longer taking place because the vaccination drive has eradicated the disease. I would take on from the universal immunization program that was introduced in 1985 in India. And the purpose of this universal immunization program is to increase immunization coverage for mother and child. And the other objectives are, to cover pregnant women, infants, and children. And the other objectives happen to be increase the immunization cover and the quality of service. The second objective is to achieve self-sufficiency in the production of vaccines and cold chain equipment, to establish reliable cold chain and monitor the cold chain and the quality of the cold chain, introduce monitoring and evaluation services, and to train health personnel to vaccinate. The UAP program was initiated in 2 or 3 stages. Initially, it was in certain regions, then it's expanded, and initially there were 3 or 4 vaccines for vaccine preventable diseases, then they have added more. And ultimately, it was very successfully implemented, causing complete eradication of polio, and maternal and neonatal tetanus was achieved. And on the production side, India has attained self-sufficiency in vaccine production, and there are several world-class manufacturing units, companies producing vaccines, and they almost produce 60% of the global load of vaccines. May I have the next slide, please? Okay. Who are the vaccinators and how the vaccinations are delivered, across the country? India traditionally uses and the existing healthcare system for vaccination, like maternity and child healthcare centers, primary health centers, community health centers, because the main objective happens to be to protect the mother and the newborn. Hospitals, dispensaries, and then they have periodic medical camps in which they have vaccination drives. Adult vaccinations are only limited to tetanus toxoid for pregnant women and those adults who get injured, either a cut or an accident that requires injection of TT for preventing tetanus. The health professionals involved in immunization are general practitioners, nurses, and other trained health care workers. HCWs is what we call. However, trained vaccinators are insufficient. And when we take these advances and compare with current scenario, the trained vaccinators are insufficient to tackle the additional load of vaccinations once COVID-19 vaccine is available. And then we are looking at a massive vaccination drive of vaccinating the 101.3 billion population in India. And we believe at the Indian Pharmaceutical Association as well as at CRFORM Forum in thinking which is in line with FIP that pharmacists are ideal to fill this gap. Next slide, please. Okay, what is the regulation and access related to vaccination? Per regulation, pharmacists are not involved in vaccinating, and there is no regulation that pharmacists are authorized to, vaccinate. The government of India, however, more recently started considering, because they are looking at the number of healthcare professionals or healthcare workers that are available to deploy when the vaccination drive starts. So they have they indicated that pharmacists could be one of the health personnel. And Indian Pharmaceutical Association took up this clue and then written to the government about deploying pharmacists into vaccination drives, because pharmacists, first of all, they are available in large number, they are aware of various aspects of vaccinations, etc. And fortunately, in response to our advocacy, the Ministry of Health, in a last month notification, has listed pharmacists as potential vaccinators, among the list of HCW. Next slide, please. So we have made a progress in that, at least for COVID-19 vaccinations, pharmacists are now listed. But what is the major barrier? Since pharmacists have not been involved in vaccinating, we need to train them. Train them on administering vaccines on all the routes, like intradermal, intramuscular, subcutaneous, nasal sprays, or even drops by mouth, whatever way that has to be administered. And so train the vaccinations by all routes, and then the vaccines, the cold chain management, and how you look at the cold chain management, and adverse event management, and pharmacovigilance, particularly of these vaccines and the new variety of vaccines, that is the COVID-19 vaccines that will be available shortly. But the good news today is that the Pfizer BioNTech vaccine has been approved. In India, there are at least 3 or 4 vaccines under phase 3 clinical trials. One is the Oxford vaccine or AstraZeneca vaccine, and there are 2 other vaccines which are indigenously developed by 2 Indian companies. But all these vaccines are intramuscularly administered, 1 dose or 2 doses, and also the Russian vaccine, the Sputnik V, is also being developed in India. So any one of these vaccines would be available, and people have to be trained to handle these vaccines and how to really manage cold chains, waste management, as Manisha Sridhar has indicated. Waste management is something we think, but that's also very important. And more importantly, since the adult Indian is not very much aware of the usefulness of vaccinations. We have to also build their awareness about the good effects of vaccination, particularly like flu vaccine, pneumonia vaccine, and hepatitis. Very few people take these vaccines. This would be better suited for building the public awareness, counseling, and administration of vaccines. This is the barriers that we face. What is the path forward is listed in the next slide. The priority actions to move forward is: one, we need a quality training program to make pharmacists competent vaccinators. For that matter, to make all the healthcare workers competent vaccinators. So we have, again, written to the government as of today to make Indian Pharmaceutical Association a preferred partner of the training. And then we also have discussed with FIP President, Mr. Jordan, to give us the training program, preferably, and then we are working on it such that a FIP developed training program which can be deployed on the platform of the regional forum and taken forward by a member organization in conjunction with the government of India. I think that would be an ideal plan to train the pharmacists, and other healthcare workers to be competent vaccinators. In addition, we also need to train them on pharmacovigilance of vaccines. But however, our pharmacy workforce are experienced in pharmacovigilance of various other medicines. But however, vaccines, particularly the COVID vaccine, we may have to give some special training. In addition to that, adverse event identification, monitoring, and reporting, as well as managing cold chain and waste disposal. So a slew of training programs have to be organized, and I believe that the regional forum, with the help of member organization and guidance from FIP, we could start deploying those things to ensure that the vaccinators are very well trained. More importantly, advocacy to the government from national and international organizations about involving pharmacists as vaccinators. The government may say that, okay, this is an extraordinary situation of COVID-19 vaccine, so we approve pharmacists as vaccinators, but we have to use this opportunity and then try to bring a legislation or a regulation saying that pharmacists are authorized to do all sorts of immunizations and vaccinations, such that in the pharmacies, immunization drives and immunization provision can be made. That is a very high priority area. And we will be making roadmaps to implement that in the Southeast region through the regional forum. And that's what I want to say this today. And thank you very much for patiently listening to me. And if there are any questions, please put it in the chat box and I will try to answer them. Thank you. Over to you, Sumalata.
Thank you, sir. Thank you so much for your excellent presentation and mainly enlightening us on training in pharmacovigilance of these vaccines for adverse event identification, monitoring, and waste management and all. Now, I request the other speaker, Lalit, to join us and to enlighten us. Dr. Lalit, who is a senior lecturer, Rajaratha University of Sri Lanka. Welcome, sir.
Thank you, Suma. Good day to you all, Ayubowan. First of all, thank you very much for inviting me and giving this opportunity to share experience from Sri Lanka in terms of the vaccination program, and especially the role of pharmacist in vaccination program in Sri Lanka. In my short presentation today, I wish to discuss the current situation of vaccination in Sri Lanka, to brief overview of the vaccination program, and also the roles played by the pharmacist at the moment in the current situation. And also I'm going to discuss about the potentials and opportunities which we would arise, and also which we have to adapt to due to the new normal and the COVID and COVAX initiatives. And also I'm going to discuss about the potential barriers and challenges we may face in meeting those needs. So the vaccination program in Sri Lanka is largely based on National Immunization Program, which is a program governed by the Ministry of Health. And the selection of vaccines for the National Immunization Program is based on the affordability burden of the diseases, and also the affordability and the feasibility of implementation. Those are the main factors considered by the expert panel advisory committee from the Ministry of Health before introducing any vaccine to the national program. At the moment, the National Immunization Program is mainly focused on vulnerable groups, largely focused on pregnant women and infants and children and immunosuppressed groups, and also people exposed to infectious diseases as occupational exposures, particularly healthcare workers. In addition to the National Immunization Program, there are vaccines again available in Sri Lanka in the public healthcare sector. Those are also provided into the hospitals. I will explain the mechanism in my next slide. But that is the vaccination situation in government sector. Talking about the key players in Sri Lankan vaccination programs, the regulation is done by National Medical and Regulatory Authority. There are regulatory pharmacists in NMRA. As you can see, I have highlighted the institutions where there are pharmacists playing a key role. So regulation is done by NMRA, regulatory pharmacists. That is one of the strong areas where pharmacists involved in our country. And then estimation for the farmers vaccination is largely done by the epidemiology unit of Ministry of Health. That is mainly related to the vaccines available under the National Immunization Program. Other vaccines available out of the National Immunization Program to supply, like to use for special situations like disaster or individuals who are at risk and other circumstances, for an example, rabies and H1N1 vaccination, and those estimations are done by pharmacists in Medical Supply Division together with Medical Research Institute and Epidemiology Unit. But considering the proportion of the work and proportion of the vaccines provided through through the National Immunization Program and out of the program, estimations is largely done by Epidemiology Unit of Ministry of Health. And the procurement and coordination of purchase is done by, again, Medical Supply Division and State Pharmaceutical Corporation. Those two institutes are there are pharmacists in these two institutes, and they play a key role in procurement and supply. But again, when it comes to the central supply, to reduce the number of exchange points to protect the cold chain, supplies are encouraged, and it is the current practice is actually most of the vaccines are directly supplied to the central storage of the epidemiology unit. That is where the cold chain monitoring and everything is done. And then the distribution from central storage, which is in Colombo, to other regional drugstores are done by pharmacists, the storage, and transportation, and then the storage in the regional drugstores and also in the uh, drugstores in regional hospitals are done by pharmacists. That is the responsibility of the pharmacist. And then they issue drugs to the vaccines to the medical office of health clinics. That is the main access point for general population for vaccines. Most of the maternal and child vaccination programs are conducted through MOH clinics, and there are nurses and midwives are attached to these clinics, and they are doing the administering. So the pharmacist's role is to supply to the center by protecting the cold chain from central storage to the end user delivery point. And the same applies to the hospital clinics. Hospital clinics are run by nurses and also the medical officers and clinicians. And pharmacists provide vaccines to the hospital clinics. And some vaccines are given for inward patients. In that case, also the pharmacists provide. In the public healthcare system, the government system, there is no pharmacy vaccine administration practice in Sri Lanka. And when it comes to the private sector is also in storage and delivery. And in addition to the vaccines available through the National Immunization Program, private sector, they can directly import following the proper regulatory approval. They import vaccines, and then distribution is done by pharmaceutical companies, and retail pharmacists are delivering those to sometimes into the end user. People can buy vaccines from pharmacies, but they have to go to either hospital or clinic to administer. So pharmacists don't administer it in Sri Lankan setting. Next slide, please. So looking at the places where pharmacists have a role in vaccination program, it starts with regulation. National Medicine and Medicinal Regulatory Authority, NMRA, as I mentioned earlier, the regulatory body of the country. They conduct the regulatory affairs and registration of vaccines. In addition to that, NMRA has started pharmacovigilance section. So the pharmacovigilance is also monitored by NMRA by coordination with the epidemiology unit of the country. And then when it comes to the procurement, the State Pharmaceutical Corporation and Medical Supply Division coordinate the purchase together with the State Pharmaceutical Corporation, SPC. And the storage and maintaining cold chain is done by pharmacists in government sector and also in the private sector. So what they do is from the central storage, private sector is from the supplier to the end user. Public sector, it is from the central storage to the clinics, end user delivery points. Those are the main areas currently pharmacists are working. As I mentioned earlier, there's no pharmacy vaccine administration by pharmacists. And looking at the success rate of the immunization program in Sri Lanka, it is one of the best immunization program in the world in terms of the coverage and timeliness. According to the recent figures, more than 99% children receive their immunization in time in Sri Lanka. It can vary from vaccine to vaccine, but it is very, very high. in terms of the coverage, as I mentioned. So, so the very well organized curative sector of the country through the medical officer of health divisions and the clinics conducted on MOH divisions, and also the active role of field officers, public health midwives and public health inspectors. So the delivery is currently happening, administering is currently happening very well. So at the moment, as I mentioned, pharmacists are not really administering the vaccination, as we have discussed in other countries, Europe and other countries from the yesterday's session. Next slide, please. Although and under current circumstances, so we are not seeking actually pharmacist involvement in vaccination, administering. We may have to think about think differently in the future in terms of the contribution of pharmacists in mass immunization. And under the COVID situation and looking at the discussions in the COVID's initiative, and we think there are two areas we need to pay attention in terms of to enhance the role of pharmacists in vaccination program. Like before we think about vaccine administering by pharmacists, there are areas we think that strengthening is very crucial. One is the vaccine regulation sector. At the moment in Sri Lanka, regulation is, as I mentioned, a strong component, and it is done under NMRA. But the new vaccination programs under COVID will bring new challenges because of the need to get vaccines into the user as soon as possible. Due to the need, the regulatory process may have to undergo some alterations or changes. And there are discussions under COVID's initiative about expedited review. The regulatory sector will have to think of fast track, and so capacity building and more training and improving capacity will need in regulation section in terms of how to deal with the regulation of new vaccine, as I mentioned, with the new need. And the procurement will be a challenge as well. So the estimation at the moment, pharmacists are doing estimation only for limited number of vaccines in the country. But when it comes to mass scale immunization, so the estimation will have to be done more precisely, and so then it will there will be need of involvement of pharmacists in the procurement process, and also as I mentioned, in terms of the regulation, the timeliness of the purchase and the procurement procedures has to be more straightforward, more short, and time consumption and things. So these areas need to be more strength under new normal under this COVID environment and in the future. And pharmacovigilance is another area, and monitoring adverse events. There were recent regulations from Sri Lanka making it mandatory for pharmacists to report adverse events, and pharmacovigilance has made mandatory for all pharmaceuticals, so it applies to vaccines as well. To coordinate that, to perform it in more effectively, NMRA has initiated a pharmacovigilance unit. There's a separate unit in NMRA. They work collaboratively with the epidemiology unit. There are trained pharmacists at the moment, but that area of pharmacovigilance, when it comes to the regional levels, when it comes to more decentralized pharmacovigilance and monitoring, more training will be needed. And storage and cold chain monitoring, we see there has to be, there should be a lot of changes in storage and cold chain monitoring in terms of infrastructure and also training. At the moment, under immunization program, AVM, VVM is done, used as the to monitor each vial. So it is very well implemented and very effectively used. But when it comes to the COVID vaccine, thinking about like Pfizer vaccine required extreme low temperatures, in terms of those, like the infrastructure and the transportation has to be more, it has to be taken more seriously, and like there should be more training and capacity building are needed in this section. And when it comes to, this is also supplying to end user, this is also part of the cold chain monitoring. But how you get vaccines into like large group of people? At the moment, it is a limited. So using MOH clinics and existing curative care sector is very effective. But when it comes to mass scaling, delivering to those centers has to be more strength, and it has to be expanded. Therefore, the community pharmacy sector can be expanded into fit into this role. And also there's another possibility to develop outreach care from hospital pharmacy. We have seen examples from recent months when the patients who have come into NCD clinics, when they could not come to the hospital due to restrictions and the lockdown. So the hospitals, all the hospitals in Sri Lanka, they started delivering their monthly supply of drugs into households together, working together with the postal department. So the patients were contacted over the phone, and large quantities were like patients receive a properly packed vaccine, named and packed to their households. When the for special vaccines, special drugs, sometimes home delivery was done by pharmacies. So it was a kind of like testing outreach hospital pharmacy. So that we see that it has to be regulated strength to face the new challenges as well. Next slide, please. That's going to be my last. And in terms of like, I highlighted the areas, then the question is, how do we see that, how do we see to do it? I think the best thing is capacity building in human resources through training programs. It's the Ministry of Health and the government sector, and also organizations like WHO and FIP. We need support for that, for training existing pharmacists, and also training, and that is a very, very important area to include these new areas to build more capacity throughout training programs in undergraduate programs. And also there is a diploma program running to train hospital pharmacists, and also undergraduate programs conducted in many state universities, and undergraduate and diploma training programs for pharmacy training should be included, considered in this capacity building, and the curriculum should be revised to include new sections. That is something we see as something to consider and propose to the stakeholders. And as I mentioned, outreach services from pharmacy, that is a new experience. And we hope that utilizing this experience in delivering drugs and will be useful in large-scale vaccination program to more effectively deliver vaccines into the end user by protecting the cold chain. And also something came into my mind when I was listening to previous two speakers about waste management, like to make it more responsibly. The outreach services from hospital pharmacy will be useful in managing waste from vaccine as well. And then the community pharmacy sector, it is very underdeveloped in Sri Lanka. Although there are graduate pharmacies coming out of the universities, a very small proportion is end up going to community pharmacy. Most of them end up in either government service or in industry. So that is the area where I need to pay more attention in long term. It will be useful for capacity building to improve storage and cold chain maintenance in large scale vaccination program. We expect to start to see very soon to tackle with this pandemic program. That is all I have to share from Sri Lankan experience. Thank you very much.
Thank you, Mr. Lalit. Thank you very much. Really, your request will be considered by FIP, because always FIP supports, and they will support us for especially public health and safety is very important for FIP. So definitely they will support you. Thank you very much. And we are very happy to know that pharmacists are taking part as a storage conditions of vaccines, especially regionally and also decentralized storage. Very happy to hear this from you. And really thank you for how explaining us how pharmacists can contribute in future opportunities and potentials in mass immunization, like strengthening existing roles and capacity building to take up new roles. Thank you very much. Now we move on to the next speaker, Kampath Gupta, who is an associate professor, Faculty of Pharmaceutical Sciences, Gurab University, and who is the Secretary General, Pharmaceutical Association of Thailand. We welcome you, Gupta.
Hello, good evening from Thailand, and thank you FIP for inviting me for a very interesting and very important issue. Next, please. Okay. When I got the email to be invited speaker in the forum, it's very lucky for me, because last year in 2019, we just have meeting all pharmacists around Southeast Asia, including South Korea, Japan, and Philippines, Malaysia, Singapore, and Thailand, Cambodia as well. We have discussion and share experience about vaccine work in pharmacy community. Different countries, they have their own job, they have their own responsibility about vaccine. But all the same is vaccination is not our job right now. Therefore, I am the representative of Southeast Asia to share this experience to everyone. Next slide, please. Okay, situation right now about vaccination in Thailand from pharmacist perspective. Like every country who is the provider of vaccination, pharmacists are excluded from immunization role, since it classifies the work of physician, nurse, and also other medical work. pharmacists can do just only about manufacturing part in Thailand. And the good news is in Thailand, more than 90% of children can reach vaccine. But the problem is only about 30% can complete the vaccination program. Therefore, it is very important to inform parents to take the children to complete the vaccination program in Thailand. And what pharmacists can do is just only do research and development and also manufacturing. And for community pharmacists, what they do is to report vaccine-related ADR to regulation organization. Next slide, please. Talk about barrier, restriction, and issue facing pharmacy. It is illegal for pharmacists to conduct vaccination, especially injection. We need law amendment to develop this system. But the most important problem is not about law. It's also about the training program, because in Thailand, we don't have knowledge or even skill to give vaccine to people. In Thailand, like I informed you already, vaccination coverage in children is very good, but it is very low in adult. Therefore, we have to inform or educate people about importance of vaccination in adult as well. And as you know already, Thailand is a very hot country. We are in tropical region. Therefore, cold chain is very necessary, especially for COVID-19 vaccination, like someone asked in the Q&A already. Some vaccine from some company need very low temperature. Therefore, we need very good cold chain system to provide vaccine effectively to people. And in Thailand, pharmacists are not treated as the first line healthcare provider, but in fact, we have many pharmacies. Therefore, when people have health problem, they're going to consult pharmacists. Therefore, if it's possible that pharmacists can provide or vaccinate people, it will be very good and very high stimulation to Thai population. And the last but not least problem is about awareness of immunization in Thai population. Next slide, please.
I think we may have Kampanart Furthen. Are you back with us, Kampanart?
Can you hear me?
Yes, please go ahead. Thank you.
Can you go to the next slide? Okay, thank you. Okay, what is the priority for Thailand and for Asian country? At first, as a pharmacist, our job is to identify patients or people who have high risk specific target for vaccination. And in short term, I mean 3 or 5 years, we have to develop strong regional vaccination industry. In Thailand, we have about three manufacturers can produce bioproducts, including vaccine. Therefore, our aim, in this term is Asian country, for example, Thailand, Vietnam, Cambodia, Malaysia, Singapore, and Malaysia, to have sufficient healthcare policy and to have possibility to encourage our economic growth through the manufacturing of biological product. And recently, Asian member states try to release Asian harmonization of pharmaceutical product, especially biological products. Therefore, in near future, we are going to have good distribution about drug and also bioproduct as well. Next slide, please. Talk about other countries in Southeast Asia. Each country, they have their own different problem. For example, in Singapore, vaccine also require prescription from general practitioner, and pharmacists are not allowed to administer vaccine. In Philippines, they have training module in pharmacy school already, but the problem if the new pharmacy law have not been released yet. And in Cambodia, there is not adequate coverage of high-risk community. The distribution of vaccine is not proper. And also they have weak community awareness and demand as well. Therefore, to solve problem in each country, we have to know the situation of that country first, and different countries, they have their own problem to solve. I think this is all about Thailand and also Southeast Asian country. Thank you.
Much, Kampana. You have rightly pointed out the restrictions and issues facing by the pharmacists all over the globe. And we feel that training program is very much essential in transforming this vaccination. As a pharmacist, it is our responsibility to implement a wide and effective public communication and education campaigns on COVID-19, maybe an effective driver in transforming vaccination. Thank you very much, Kampana.
Thank you.
We extend our invitation to our next speaker, Mr. Yagya, who is ex-chairman of Nepal Pharmacy Council. Welcome, Mr. Yagya.
Hi. Hello. Good morning and good afternoon and good evening, everybody. Thank you very much, FIPE, Federation of International Pharmaceuticals Association. Many of my previous speakers, they have conveyed all necessary infos from different area globally. This is nice. And once again, thank you very much. Coming to Nepal, I have worked at the capacity of Nepal Pharmacy Council Chairman in between 2011 and 2015 as a government body and under Ministry of Health. I have rendered my pharmaceutical services at different capacities, manufacturing, policy making, auditing, and at extra. I'm very glad to share my views from Nepal, Kathmandu. Nepal, Himalaya, and mountainous and Tarai, and 77 districts, and we are landlocked. India, south, China, north, Himalayas, and plain area, north and south respectively. I have assigned to speak for the situation of vaccination by pharmacists in my country in terms of regulations, access, and general progresses. And if the agenda is not progress, then what are the various restrictions and issues facing pharmacy, my country? In either case, what are our present status? Well, it's like 2012, New Zealand started using pharmacists for different types of vaccination. And in recent days, United States of America have assigned pharmacists to engage in all 50 states for vaccination. But in our part, in Nepal, pharmacies are competent enough and capable to conduct vaccination procedures within required administration and in overall. But we lack in the guidelines and laws as in other Southeast Asian countries. It is really nice that a huge gap of manpower can be filled up by trained and professional pharmacists while going on mass vaccination. And it's useful, their skill and their caliber can be used in Nepal as well. But we do lack in different field, particularly the guidelines and regulations part. In Nepal, we have NIP, that is National Immunization Program, which started long back 1978. We were polio free since 2010, and earlier this was done by Child Health Division, Ministry of Health. Now is managed by Family Welfare Division. Nepal, we have public hospitals, private hospitals, and community health center, and polyclinic type of arrangement. And we have, of course, immunization service room, consulting room, defined immunization area also. But due to the lack of regulations and guidelines at the government and at the Ministry of Health, the pharmacists are yet to engage in such mass vaccination program. So we shall be requiring appropriate and applicable guidelines by FIP or WHO in coordination in the larger context for employing pharmacists into vaccination program. Coming to COVID-19, the pandemic and all, we are also facing the similar type of problem, similar type of circumstances as in India and in some Southeast Asian countries like Sri Lanka, India, Pakistan, Bangladesh, and Philippines and all. So we need to work with the Ministry of Health, Government of Nepal, and other different stakeholders body to employ and engage pharmacists in such mass vaccination program. Of course, the pharmacies, they can be used for management, adverse event management, pharmacovigilance, and logistic management while going on mass vaccination program. And their skills and their caliber and their knowledge and their facilities can well be employed or can well be taken into account. In Nepal, we have logistic management division under Ministry of Health, that they have a central drug storage facility, and vaccine and Sira are also in one of the division of this logistic management division, Ministry of Health. And this goes to regional medical stores and go to different district hospitals and district health posts distribution wise. And in present text, in present law, pharmacists are employed in government hospital, regional hospital, private hospital, polyclinic, and health posts, and even private healthcare facility. So their presence and their engagement in comprehensive vaccination program and comprehensive health care system can well be assigned and can well be implemented. But again, comes the question of regulations and law. As per our law, a pharmacist is not allowed for giving injection or giving vaccination until now. They are the supportive body in national healthcare system. Doctors are allowed, nurses are allowed, and health assistants are allowed. But other paramedical staff and paramedical forces, including pharmacists, they are not allowed for injections and vaccines on people. So these are the overall scenario, and these are the overall system of pharmacy and pharmacists in Nepal. And we are divided in Nepal Pharmaceutical Association, Graduate Pharmacist Association, Nepal Pharmacy Council, Department of Drug Administration, and Ministry of Health, and Pharmacists Horizon of Nepal. These are the different bodies in a coherent and in coordinated system that are employed in pharmaceutical services. And I shall be, and we shall be more pleased if we have some comprehensive and applicable and implementable guidelines by Federation of International Pharmaceutical Association and WHO to employ and to engage Nepalese pharmacists into vaccination, and particularly in the context of COVID-19 pandemic in days to come. If these things are taken into consideration and proper guidelines are put into implementation, of course, Nepalese pharmacists will render their services with their best skill and capability, and they are widely and freely available in the country. Thank you very much. Thank you very much.
Thank you very much, Mr. Yagya. Really, we are very sorry to hear about the lagging and drawbacks in guidelines and regulations which were there in Nepal. And definitely FIP would support and guide you in this regard. We request FIP to take up this request. And we are very happy to inform all the participants that among CR from region countries, India is listed pharmacist as a potential vaccinator to be developed, which is initiated by President Dr. T.V. Narayana, Indian Pharmaceutical Association, in support of Dr. Rao Adlamodi, President Commonwealth Pharmacist Association. Thank you very much, Mr. Yagya.
Thank you very much. Thank you very much. Thank you very much.
Now I request Mr. Ash to take over this program.
Thank you.
Over to Ash.
Thank you, Suma. And thank you, all our speakers. You've been fantastic. I just wanted to ask you, all the speakers, one question. And I see some of you, particularly Rao, you've answered quite a bit in the chat box. But there is a general question about how and what FIP can do to help all of the countries to enable pharmacists potentially to vaccinate. Is there something that they can do with WHO from a global basis, and is there something they can do to support you with each of the regional, in your region, the WHO locally? So please, if this is just some views. So shall I start, Rao? Shall I start with you? As I can see you.
Yes. Thanks, Ash, for asking that question. Really, in our experience in India, you could do a lot of advocacy with the government, indicating the pharmacist is the preferred partner in immunization program. They can do this, they can do that, and we continue to do that. However, over a period of time, the advocacy doesn't really deliver what it is supposed to deliver, because in the government, they say that, oh, yeah, we got another letter from IPA kind of thing. But if that advocacy, under conditions like that, the current situation, like COVID-19 vaccines, and then the governments are looking at a major load of vaccinations and looking at vaccinators, who could deliver that. A letter from FIP, like an international organization, a letter from WHO regional office, indicating that in various other countries, pharmacists are already doing this job, and you have a potential pharmacist who could do this job, so that is the ideal way to go. That, I think that would have a great impact on the government, along with the local MOs, member organizations doing advocacy, supported with these letters. I'm sure then that makes the government to take a note, because the letters are coming from internationally acclaimed organizations like WHO and FIP. That's one thing. That I think it's training is another one, or even looking at the training programs to see whether these training programs meet the standards. That's another thing. But you need to train once people are approved or they are authorized to inject. But which one is the first? Egg first or chicken first? It's very difficult. Do we train first and then ask the government, or when the government says yes, we need you, then we train ourselves? There's no clear answer there, but I think we should have both approaches, and FIP could help in both approaches. That's what I think.
Thank you, Rao. Can I, Lalit? Can you? I can see you're in my list. Looking down. What's your view? What could FIP do?
Hi. I think looking at the priorities, as I explained, I think in Sri Lanka, in terms of Sri Lankan situation, it will be like more important to strengthen the distribution to end user rather than at the moment looking at the administration. That is my opinion, because we don't see any problem with the current program with the administration of vaccine. But even with the mass scale vaccination program, the existing system can tolerate to some extent, but the problem happened with the supply chain and the regulation. And also another thing, I couldn't mention it in the in my talk, advocacy with the communities. There's a growing elements of hesitancy in vaccination in terms of the immunization program, and we like even yesterday I had a chat with some of my colleagues, and our observation is that there should be a level of hesitancy for the COVID vaccine if it going to be available. So so the advocacy role and strengthening the role of pharmacists in maintaining the proper supply chain to even to the end user, and also how to manage with the waste and the regulation, and also proper procurement. Those are the areas at the moment we need more attention. And before that's if you prioritize it based on the current circumstances.
Thank you. Thank you.
And 1 minute I say ask like what sort of support we expect from organization like FIP, and then like the training of pharmacists is done by state universities and also by Ministry of Health, and any sort of collaboration with the Ministry of Health, universities, and also pharmaceutical society of the country. And that will be a very good initiative to think about, identify again in a broad stakeholder negotiation to identify key areas and prioritize, and then get your support to develop the area. Thank you.
Thank you, Lalit. Yagya, any views on what FIP could do there? Sorry, I'm going to have to make you, if you could be brief though. Sorry. You're still on mute at the moment. That's it.
Yeah. Nice again. Yeah, particularly in Nepal, in our context, we are after the absolute guidelines. Absolute guidelines. We shall be working with the Ministry of Health, with the different stakeholders in the pharmaceutical services, and my humble request with the FIP is if we could have the guidelines for the pharmacists in mass vaccination program, particularly COVID-19 pandemic in days to come. And I am personally ready and personally prepared to take up all these matters and things with my ministry, subject to if we could have proper guidelines and proper suggestions by Federation of International Pharmaceutical Association. Thank you.
Thank you, Yagya. And Kampanak?
Yes.
What could FIP do to help?
Actually, in Thailand, we don't have proper guideline for pharmacists to vaccinate people yet. Therefore, like GPP, if FIP can produce guideline or suggest, recommend low risk vaccination for pharmacists, and then Pharmaceutical Association of Thai Pharmaceutical Association can use this information to encourage Thai government to let pharmacists to provide vaccine to people. In Thailand, we don't have vaccination coverage right now because we focus only children vaccination. But like already, children vaccination is not enough right now. Therefore, spread or extension of vaccination by use pharmacists as a healthcare provider is really important. So I hope FIP can find a solution and guideline for us. Thank you.
Thank you. Thank you to all of you. What's come through loud and clear are the two things that FIP particularly can do at this stage is, alongside WHO, is to provide some guidelines, some pressure to see pharmacists as vaccinators, and probably, I think, to come up with some standards on training for each of the countries, which is seen as a global standard for quality of training that we can develop and can be delivered by then according to what each country needs to do. But that's really useful. Thank you. I think that gives us a really clear thing about what we can use going forward into the summit and what comes out of this whole program. Could I have the next slide, please? Thank you. Before I just mention what's on this slide, can I just once again, particularly thank Suma as my co-moderator. I know Lena's gone, but to thank her and Farah and the FIP Ali as the digital team to supporting us in this program and for everything you've done. And to thank my speakers for an extraordinary and very clear, very, very professional presentations, which gave such a lot of information about the things, the real challenges that we face in using pharmacies going forward. So for those that are interested, there is another one of these. There's a series of these. There's another one, episode 3, which is tomorrow, which is from the Eastern Mediterranean, and you have the opportunity to join that session as well for driving transforming vaccination in the Eastern Mediterranean region. And this will also discuss the progress made in those countries, the quality and universal access to vaccines, and discuss the barriers and challenges in the way we have today, and things that FIP can do, again, to support that program. So if you wish to join that program, to just be able to see what else is going on in other parts of the world, register online at transformingvaccination.fip.org. Can we go to the next slide, please? And finally, please remember, all of this is designed to culminate in the FIP Global Virtual Summit. Everything that we are, as FIP, are hearing, learning, seeing through this program will help us to reach the agenda that we wish to achieve on behalf of FIP and for all of the member organizations, and for the global development of pharmacists and the pharmacy workforce. So please, if you have the opportunity, come and join the Global Summit on the 17th of December between 2 and 4 Central European Time. Again, if you go to transformingvaccination.fip.org/summit, you can register there. And then, of course, this will give you the time according to your own countries. This, as I say, is a critical high-level event to recap the primary outcomes of the whole series and adopt the FIP commitment to action on vaccination in pharmacy, which will be launched during that summit. And this is a real opportunity to see global leaders from health and pharmacy joining together in this landmark event. Next slide, please. Finally, thank you for participating. It has been an absolute pleasure to be able to moderate this, and thank you to my co-moderator, Suma, and to my speakers. It has been fantastic. Recording of this episode will be available at www.fip.org and www.transformingvaccination.fip.org. And your feedback is very welcome at webinars@fip.org. This is really useful because it helps us to develop future webinars. Thank you for everything that you have, all of your comments and all of your questions and everything that's been done. I apologize, I couldn't answer the last question. I don't know if anywhere in the area is currently providing vaccinations for COVID, but I believe that the only countries I know where there are licenses, as far as I'm aware, are Russia and China currently. But I said, if there are any other people that have answers, please let us know. Thank you so much for participating today, and I look forward to speaking to you again in the near future, and good day to you all, whatever time it is in your country. Thank you.
Thank you.
Take
Thank
care.
you, Ash.
Thank
Thank
you,
you very
Ash.
much.
Thank you.
Thank you, Dr. Manisha Sridhar, Dr. Rao Adlamudi,